So, in a study that was recently conducted prior to this pandemic, but we were very, very concerned about a flu outbreak. And so, this study was done by colleagues trying to understand how to mitigate a flu pandemic in Hong Kong, a very dense urban city where we would have an index patient with a highly contagious flu. Everyone was occupying buildings with one air change per hour in the buildings, a very low ventilation rate. So all buildings were low ventilation, which is pretty typical of our US housing stock in general. And if we can adjust the approach by which we contain this virus outbreak, then we can reduce the impact of this pandemic. So we take clean virus-free air supplied by ventilation, dilutes the indoor shared air, and it reduces the virus levels. The contaminated air is exhausted by the ventilation, removing the infectious agent. And studies show that this building ventilation can be as effective as public health interventions, but that existing ventilation rates are too low and might need to be increased by 10 times. So in this study, we start out at one air change per hour. We increase the ventilation rate of all buildings in Hong Kong air changes per hour. And in the top graph, you'll see on the y-axis is the percent of daily infectors. So the percent of daily infectors is really, really high when we have one air change because everyone's transmitting the disease to everyone else. But as we reduce the number, as the number of daily infectors gets reduced, as we start to ventilate the indoor spaces at higher and higher levels, because now we're diluting the indoor concentration of virus, and there's no longer this aerosol transmission happening as frequently. The lower graph shows the attack rate of the disease, which is at 100% for even 4 air changes per hour in a ventilation in a space. But again, as we increase our ventilation rates up to 9 air changes per hour, the attack rate decreases dramatically. Next slide.